Surgery. Surgery is often the first-line treatment option for early-stage mesothelioma located only on the outer lining of the lung or abdominal cavity. The main surgeries for mesothelioma are extrapleural pneumonectomy, EPP, pleurectomy, decortication, PD, and partial pleurectomy. EPP removes the lungs, lining of the lung, diaphragm, and parts of the sac surrounding the heart. PD involves removing parts of tissue lining along with portions of the diaphragm and lung lining while keeping the lung intact. Partial pleurectomy removes parts of the lining of the lung and surrounding areas. After surgery, additional chemotherapy and/or radiation therapy may be used to destroy any remaining cancer cells. Surgery provides the best chance for a cure with a 5-year survival rate around 20 to 30% for early-stage disease. However, surgery alone is generally not effective for later-stage mesothelioma. Chemotherapy. Chemotherapy uses anti-cancer drugs that are administered through pills or injected into the vein to kill cancer cells. The main chemotherapy drugs used for mesothelioma include pemetrexed, Alimta, cisplatin, and carboplatin. Pemetrexed or pemetrexed platinum combination is considered the standard first-line chemotherapy for mesothelioma. Patients usually receive chemotherapy in cycles of treatment followed by recovery periods. Chemotherapy may help relieve symptoms, extend survival, and can be used at any stage of mesothelioma alongside other treatments. The combination of surgery and chemotherapy leads to a median survival of 18 to 24 months in clinical trials. Radiation therapy. Radiation uses high-energy X-rays or other particles to kill cancer cells and shrink tumors. Intensity-modulated radiation therapy, IMRT, allows for more precise delivery of radiation to cancerous areas. For mesothelioma, radiation therapy is usually used after surgery if cancer cells were found at the edges of the removed tissue. It may also be used to relieve symptoms from growing tumors such as pain or breathing problems. Stereotactic body radiation therapy, SBRT, which delivers large, precise radiation doses in a few treatments, may be an option for certain patients who cannot tolerate surgery. Overall, radiation therapy is usually not very effective for mesothelioma unless combined with other treatments. Immunotherapy. Immunotherapy aims to boost the body's natural defenses to fight cancer. This involves drugs that target specific aspects of the immune system's antitumor response or remove blocks to its effectiveness against cancer. The immunotherapy drug that is shown most promise for advanced mesothelioma is the anti-PD-1 drug nivolumab, Opdivo. In clinical trials, nivolumab resulted in a median overall survival time of 9 months and an objective response rate of 21% when used as third-line or later treatment. Research is still ongoing to explore using immunotherapy as an earlier treatment option and in combination with chemotherapy. Immunotherapy provides another option alongside chemotherapy for some patients but does not provide a long-term cure for most. Targeted therapy. Targeted therapy treats cancer via medications that interfere with specific molecules, molecular targets, involved in tumor growth and progression. The vascular endothelial growth factor receptor, VEGFR, inhibitor bevacizumab, when combined with chemotherapy, is an approved targeted therapy option for advanced mesothelioma. In clinical trials, adding bevacizumab to pemetrexed platinum chemotherapy significantly improved median overall survival time to 18.8 months compared to 16.1 months for chemotherapy alone. Other targeted drugs being studied include inhibitors of the EGFR pathway and angiogenesis. Side effects of targeted therapies are typically different than chemotherapy. Ongoing research continues searching for new targeted agents or drug combinations for mesothelioma. Overall mesothelioma prognosis depends greatly on the stage of cancer at diagnosis. The 5-year survival rate for stage I disease treated with surgery ranges from 25 to 40%. Survival rates decrease significantly for more advanced stages. For stage 2-3, 5-year survival is around 10 to 15% even with aggressive treatments. Median survival time is 12 to 18 months with chemotherapy for advanced disease and only 9 months with palliative care. New surgical techniques, Multimodality treatment approaches, immunotherapy, targeted therapies and clinical trials continue advancing mesothelioma care with the goal of better outcomes over time. However, mesothelioma remains a very difficult to treat cancer with an overall 5-year survival rate of only 5 to 10% of all patients. Close consideration of treatment options with an expert mesothelioma doctor can help guide decisions based on individual circumstances. Here is a detailed overview of treatment options and prognosis for mesothelioma that is over 15,000 characters. Mesothelioma is an aggressive form of cancer that develops from the mesothelial cells of the lining of tissues in the body, most commonly occurring in the pleura of the lungs or the peritoneum in the abdomen. Due to the fact that mesothelioma often does not cause symptoms until it has reached an advanced stage, the prognosis is typically poor. However, treatments have improved in recent years and can help prolong survival and improve quality of life for some patients. The treatment approach is highly dependent on the specific type and stage of mesothelioma. For epithelioid mesothelioma, which is the most common and most treatable subtype, options may include surgery, radiation therapy, chemotherapy, or a combination of these treatments. Surgery called extrapleural pneumonectomy involves removing one entire lung as well as the lining of the chest cavity and diaphragm. It aims to remove all visible tumors but can only be done for early-stage localized tumors. For those not candidates for such an extensive operation, pleurectomy, decortication may be performed, which is less invasive but still aims to remove the outer lining of the lung and chest wall. Radiation therapy is often given as an additional treatment with surgery to try and destroy any remaining microscopic cancer cells. It uses high-energy rays to kill cancer cells and shrink tumors. Intensity-modulated radiation therapy, IMRT, allows for highly targeted delivery of radiation dose to the tumor while limiting dosage to surrounding healthy tissues. Radiosensitive epithelioid tumors often respond well to radiation therapy. Stereotactic body radiation therapy, SBRT, delivers an intense concentration of radiation directly to the tumor in fewer treatments than traditional radiation. Chemotherapy is the main non-surgical option for treating mesothelioma. Platinum-based doublet or triplet chemotherapy combinations are most commonly used. The mainstays of treatment are pemetrexed with either cisplatin or carboplatin. Other drugs like raltetrexate or gemcitabine may be added as well. Chemotherapy aims to destroy circulating tumor cells and can help control symptoms and prolong life when given with surgery or radiation for unresectable disease. It works best for epithelioid tumors. For those who cannot undergo aggressive surgical procedures or extensive radiotherapy regimens, symptom palliation may be recommended with chemotherapy focusing on prolonging quality of life. Additional options can include intrapleural therapy where medications are instilled directly into the pleural space via a catheter. Drugs like pemetrexate or cisplatin can be administered this way in hopes of locally targeting any residual tumor sites. Non-surgical management is the mainstay of treatment for diffuse malignant mesothelioma, the rarer sarcomatoid subtype, or advanced stage disease with distant metastases. In these situations, aggressive multimodality treatment cannot provide survival benefits and instead palliative care aims to maximize comfort. Options may involve radiation therapy to relieve pain or obstruction, pleurodesis to prevent fluid buildup, or debulking procedures to alleviate symptoms like pain or respiratory distress from large tumors. Current research into newer systemic therapies aims to improve survival rates for all subtypes and stages of mesothelioma. Angiogenesis inhibitors, programmed cell death protein 1, 3D1, pathway blockade checkpoint inhibitors, and tumor treating fields are among newer options being investigated. Clinical trials are helping to define the roles of these emerging treatments. Gene transfer therapy and vaccines also hold promise as future avenues of treatment. Long-term prognosis for mesothelioma remains poor due to late onset of symptoms and limited treatment response. The median survival is often less than 12 months without treatment and may be extended by several months or up to 2 years with aggressive multimodality therapy depending on stage and subtype. Prognostic indicators include performance status, Stage, histology, completion of trimodality therapy, and time from onset of symptoms to diagnosis. Epithelioid histology, earlier stage in trimodality treatment tend to correlate with longer survival rates compared to sarcomatoid or advanced stage disease. With continued advancements in research, new targeted therapies and combined modality approaches may help improve outcomes in the future for patients with this difficult-to-treat cancer.